So, Dr. Laura Dabney, I'm really, really excited to be meeting with you today and to explore your new book and talk about the work that you've been doing and where things are going since last we've talked. Um, I want to get into the new book. I Need You Now Go Away, Reclaiming Your Life When Someone You Love Has a Personality Disorder, which is a topic of great interest to me, as you know. My background in gender specific medicine and men's health and related issues, I think really tap into some of the things we will jump into. So, welcome, Dr. Laura.
Thank you so much. I'm just as excited to be here as you are to have me, and maybe more so.
Super. Well, but before we get into the book and more about your work, what I like to ask my guests to start off is a little bit about your origin story. How you got interested in the healing professions, and then we'll get into more about that whole process. But tell me how it started for you.
Well, I was always interested in studying humans, especially how they function, their behaviors, and especially those who have struggles when they seem so capable or were very capable in other areas of their lives. I was drawn to medicine because that seemed like the most logical way to study humans, but in a structured format. That changed, of course, over time. And pretty quickly in medicine, I realized that people don't just struggle medically, they also struggle emotionally and relationally. So they aren't just dealing with illness, they're dealing with patterns of behavior within their and how they deal with their relationships and with themselves. So that's where I
Indeed.
sort of got more focused on
Well, so
psychiatry.
I would just cut in on you and ask a
Yeah.
little bit more because a lot of people don't know about what doctors do and what psychiatrists do. So maybe share a little bit about what kind of what your vision was when you went off to medical school. What did you imagine that was going to be like, and how did that go? And then we'll kind of talk more about psychiatry and then kind of get into more depth. But I think since most people don't know very much about it, this would be a good chance to enlighten them and share a little bit about your perspective personally of what you went through in this process.
Yeah, sure. So I was very fortunate in that although I had nobody in my family that was in medicine, I did have my now husband, my boyfriend at the time, was a physician. And I met him because I did a year's worth of work at Georgetown Radiology Department. So I got to see firsthand a little bit more how medical school and residency, which is where he was at the time, works. And again, my fascination with humans just, I imagined in med school and residency that you just dive right into that. You learn every organ system, you learn it in detail. And I knew that I was interested in mental health to some degree, and I knew that we also went into great depth about that as well. And that did end up being true, actually. So I got this great overview in a structured environment, which is exactly what I wanted.
So then beyond that, many people don't know that after you become a doctor, there are then specialties that doctors go into. As you know, I was in medical school for a time and I dropped out. I wanted to get into some of the areas of mental health, but at the time I was in medical school, things were really too restrictive for what I wanted. So talk a little bit about the next step for you of you started training in psychiatry. What was that like for you, and how did that jive with what you had hoped, and how did you get through that process?
Yeah, so it's true that medicine is very broad and they have you go through all the steps. And if I were maybe more like you and much more interested in psychotherapy or clinical work in mental health, I probably would have maybe dropped out as well. But at the time, I was really struggling with an interest in neurology as well as psychiatry.
Mm.
And there's a lot of overlap there for people who don't know that. So I thought, well, in residency training, so after you get your MD, you go on into the training of your field of choice. So the radiologists go to radiology residency, and internal medicine goes to internal medicine. And I went off to psychiatry, which has a mixture of neurology. And I thought, well, that will be for sure where I figure out what exactly I want to do. And that ended up being true as well. So luckily for me, I went to the same school to do my residency training as I did my medical training. So again, I always had this sort of foresight. I was able to go over
Yeah.
there and sit in on classes and talk to different teachers there. And so I had a pretty good idea. And I didn't apply anywhere else.
Okay. So
I
you were
had a
really focused from the beginning, and so now kind of take us now into the present about what you do now, how you've gotten to the place from your training, from your background to the work that you do now, and tell us a little bit about your present practice, how long you've been doing it, how that's evolved, and kind of where things are now, and then we'll get into how that ties in with the new book.
right. So I was particularly interested when with the residency program I picked that they trained their residents with all the different types of therapy that are popular in this day and age. So I felt that was really important for me to be able to pick something that suited me. We only not only learned all the different therapies, outpatient therapies, we also learned all the inpatient and emergency psych, but we also learned about the consult service. So this is where I really saw the difference between medical problems and then how the relational problems the patients had, either or with them, again, conflicts with their own emotions or conflicts with other people, came up because we'd be called to solve that up there. So I really loved getting that full 360 view. And at the end of that, I fell in love with psychoanalytic therapy, also known as psychodynamic therapy, where we look more into the not just we deal with the current symptoms that the patient presents with, but also go into more under the surface matters such as personality style and relational patterns and conflicted emotions. So that was where I opened my practice. And I thought, this is what I'm going to do. I had a mentor who did this, so he helped me do that. And that mentor also had a group in which we all met and talked about our cases.
Ah.
That was a huge relief because I was terrified about doing this on my own. When in residency training, you always have someone helping you and guiding you. So this was a nice bridge to having my own practice. And then I started in general psychiatry in that way.
And your practice, I know a little bit about it, is pretty unique. I mean, there are a lot of different people over the years that practice psychiatry and people that are looking for help for various things, have lots of options. Talk a little bit about what's unique and different about the work that you've been doing.
Well, so I started in sort of general psychiatry, working with medications and psychotherapy, which soon morphed into realizing that I was actually getting more joy from and helping more people with their relational patterns that weren't working. And especially, as you know, very high functioning men in particular, but high functioning people in general, who just couldn't understand why they could have all these great relationships at work and in their social lives, but could not get an intimate relationship to their satisfaction. And it just really flummoxed them. And I suddenly had to practice with mostly those type of problems. So I quickly switched into the that focusing on more of a relationship style of therapy. And then that sort of then morphed into realizing over a few decades that not everybody needs therapy. Sometimes people just need a different viewpoint, a different direction. And so I developed Relationship RX, in which I have all kinds of free resources, all of my blog posts, articles, videos, etc., are on there for people who are afraid to come in or don't want to come in or it's not practical to come in. And then I also do relationship consulting there. So it's just a 1 or 2 time meeting to help people get direction and clarity on their relationships.
Super. Well, as you know, I found your practice some years ago and learned about it, and there's not a lot of people that have that kind of background that have an
Right.
interest and skill in psychiatry and relationship and work with men. I mean, you say you work generally with men and women, but a lot of the work that I've been doing has been with men and their families, and that kind of overlaps with you. So,
Definitely.
talk a little bit about how, as you know, I've written 17 books on various aspects of health and relationship. And, to me, it's very exciting. When I did my first book, and each book is kind of like a child. They birth from you and they're each unique. But talk about how you started to get the idea to want to write this book and a little bit about kind of the how the process has been as you're now getting close to the book coming out into the world.
So I wanted to rewrite the narrative I was hearing about personality disorders. Uh, Personality disorders are not a certain group of type of person or people. It is a group of people who are terribly conflicted about both closeness and distancing. So a healthy, intimate relationship requires movement from closeness and distancing and tolerating the pain points that come up with each of those. I mean, we all feel we lose a little bit of ourselves in closeness and we all maybe get a little lonely with distancing, but we tolerate that for the greater good of the relationship and the benefits that come with that. But these people have almost a phobic reaction to closeness and distancing. So they never really get the full benefit of either of those, and they kind of get stuck in this gray zone. And we've heard a lot about how some people deal with that or stay in that gray zone by being haughty or dramatic. But we haven't heard the other end of the spectrum, which is also very true, is people can deal with that by withdrawal or helplessness. And not only are they struggling because a lot of this is unconscious, they don't know they're in this pattern, but the people who are in a relationship with them struggle because it's so disconcerting to them. It's very hard for them to understand what's going on. So this has become a great satisfaction to be able to help people with this push-pull relationship pattern.
Exactly. And the title is great. I need you, now go away. I called it when, I've dealt a lot with that in my own practice, in my own life. The approach avoidance dance. It seems to
Yes.
be, I don't know if you're experiencing it as more common than it used to be, but it seems to be a lot more prevalent in so many different relationships and a lot more challenging. And as you point out, the person themselves, often a male, is in it but is suffering, and the partner is suffering as well and just don't know what to do. So, talk a bit about specifically your book and who you wrote it for, and what what maybe are a few of the initial things that distinguish it, and what you would want people to know if they were tuning in for the first time and just grabbing a hold that says, "Yes, I need this book." What would you say?
Well, in the book, actually, I say the estimate what I read in research that I read was 10% people suffer from either the traits or the full blown disorder. But I thought that was kind of low. So I'm with you. It either seems like there's more, or maybe the attention it's been getting has pulled people into treatment, which is, I hope, is the case. But what I was very focused on, and people actually discouraged me from, was talking directly to people with personality disorders or those who think they have it. I was told, and it is common knowledge, I'm not sure how true it is. I don't think it's all that true, maybe not as much anymore, that people with personality disorders don't know they have them, but they do know they struggle with relationships. And that's why I really focus on the relationship pattern in this book, and I focus on that more than the more maybe what's been talked about so far. So that I speak directly to them and make it very, I try very hard to get away from the negative viewpoint by comparing it all to some likable character that we know in from movies and TV. So that helps bring it bring it down into a more realistic viewpoint of these people. But I also want to address the people who live with these people
Mm,
as well. So I have in the book, in each chapter, I go through the most common personality disorders and practical, you can do yourself tips and guidance on how to change that behavioral pattern for both the person who has the disorder and for the person who's in a relationship with that person. My main point being, you have the power to change this. A lot of people come with a lot of dread that this is not possible to change, or people come in thinking they have to change the other person, which, of course, as we know, doesn't work. So like, you, I'm not oversimplifying it, but I am narrowing it down to if you change your behavior pattern, if you change that, the whole relationship pattern changes, and that other person has to make a change.
yeah. Well, give us a couple of examples of what are some of the common things that you would see in your practice or that people would be dealing with that they would come to you, and how do you address them in what you did and now what you say in the book? Give us some examples of how this shows up commonly so people can get an idea of what these common patterns are.
Well, because it's really not that well known and unconscious, people always come in with a classic symptom of an emotional problem, typically panic, anxiety, or depressive symptoms. So I always, of course, address that first.
Okay.
That helps us build trust and helps them find some relief. And at the end of that, I start suspecting there might be a personality disorder. The patient will then talk to me about finishing up treatment. And either I share this in the book, they drop a bombshell like, well, there's really not much else to talk about except I'll probably leave my wife or my husband because of this. And so then I explain the process. Well, if you want to stay and work on that, this is what it involves and this is what it entails. And what that shift right there is really important. So whether they recognize they have a relationship problem or I recognize, I approach that with them, explain what happens next because it's a long and involved process. It's not an easy problem to change. But then we shift to the relationship in the room. So when they come with a problem, an emotional problem, they talk about what's outside the room and we fix that. But when it comes to the personality sort of piece, we have to talk about their reactions to me and I have to give them the new template, the new pattern of how to deal with those relationship patterns. So that's what we do from there.
Interesting. So, who typically comes first? I know in my practice early on, it was women who often came first with, I've got a problem with my husband, or he's got, and she would be the one that would show up and often insisting that he won't come for therapy or he would never come to see you, and so I would start finding out her and what she's dealing with. And then often surprising to her, but not to me, if you reach out to men who seem to be resistant or no, I don't have a problem, or no, I can handle it, or we can handle it, or I don't want to talk, all the ways in which people hold back. Once you give them a safe place in order to know that they're not going to be beaten up on, they're not going to be made the bad guy, they're not going to be, put down as
Right.
many, people fear, then they're very forthcoming. So has that been your experience in terms of how people get in to see you and how it evolves once they're there?
Similarly, the people who come tend to be the men, but they're coming at the duress. They've either been threatened or brought in for the initial session with someone to make sure they're there. And just like with you, once we start talking and they realize I'm not, a lot of people fear that I'm going to take the woman's side.
Right.
So it's hard for them to open up about things like affairs or different fantasies they have because they think I'm going to immediately jump in. So once they realize it's a safe place and we're going to be curious and not judgmental or punitive, then they stick around without the duress.
Yes. Well, one of the things that I want to tie back between the book, your practice, and kind of where things go from here, um, that ideally we would like to see people in person, and it's fairly new in the world when I started out, and I'm sure when you did. Coming to see somebody meant you walked physically into your office and they sat and I could see them and touch them and hug them, whatever. And now so much is done online and virtual as we're talking.
Right.
Um, so how does your practice now? Uh, do you see people online as well as in the office? Do people come in exclusively to your office? Get a sense of what your practice looks like now. And obviously, the book will be something that people will read, hopefully, all over the country, maybe all over the world. So how we'll get into how people can actually stay in touch with you, get the book, and reach you in a minute. But give a sense of how your practice works now and how it might expand as the book comes out and more people know about it.
It's such a great question, especially timely now because I'm trying to transition into less. But this practice has been built up. Um, I've just expanded greatly in terms of my different projects. I also work with, as you know, with the Veterans Affairs Association. I do consulting for various groups. And as much as I enjoy the veterans, and I've had veterans in my family, and that's a whole special niche there. But the being able to go into deeper therapy with people is really my joy. So how to transition just to that. That's almost like going back to my roots, where it's just me and my answering machine. But the most interesting thing you're talking about there is the video sessions. It did not take off like we all thought it would when it first became available 20 years ago or more. And I think it's because of what you're saying. There's something about meeting somebody in person. But what's another interesting point is once I've seen them in person, and they tend to agree, and I've talked to other therapists about this, once we've met in person, even just a few times, switching to video is fine. I think because unconsciously you're feeling, you can fill in the rest of the person or something. But it does seem to be important to meet first physically and then switch to video. So I'm trying to find a way to morph this practice into that.
Yeah. Well, that was kind of what I found. I started out when, for me, more than 50 years ago, seeing people in my office. And then I wrote my first book and my second book. And all of a sudden, I was getting people calling me from other parts of the country where it wasn't easy to just walk down to the neighborhood office. And so
Right.
I had a very similar experience to what you're describing, where I said, well, I really, if you can, I'd like to see you here. In my case, I live in California. And so I had people would come, kind of take a little mini vacation sometimes to come to, my area of California. And I would have, an intensive session with them since they were coming a long distance and
Yeah.
then follow it up where they would do online and we would do take advantage of the technologies. So it's certainly possible now where we can provide interesting, connecting, new, innovative work with people who are not able to come directly into our office or can do it for an initial session and then they go back to wherever they may live and we continue on later. So I'm glad you can do that. Why don't you share two things? How
Mhm.
people can find out about you and your work, what your website is, how they do that. And then, your book, let us know when your book will be available and then how people can get your book once it's out in bookstores all over the country, hopefully.
Well, right now the book is available by pre-sale, uh, and so on Amazon. And then it comes out to the bookstores, et cetera. The publication date is June 9th. So June 9th, it'll be available more places.
June
And
9th,
then
2026 is its
2026, yes,
yeah,
this is June.
its birth date, end of the world. Yeah.
Well, you mentioned giving birth, but I actually was told back when Hachette agreed to publish it that it would take 9 months. So for me, it's very much like
Yeah,
having
yeah.
another baby.
And that's
So
fast, as I know from that means they really, and for those that don't know, Hachette, that's a really top-notch publisher, and for them or any publisher to bring a book out that quickly means one, they really are supporting it, they really think it's a an important book, and they're willing to do a lot of things to be sure it moves along quickly through the very complex processes. So, yeah, that's exciting to have a book come out 9 months. They all feel like babies, but some of them, for me, and most traditionally, take longer than 9 months to get out into the world. So that's great. I look forward
yeah,
to holding that in my hand, as I'm sure you do once it's there.
yours is going in the mail today. I just got the books
Oh,
yesterday.
good, good.
So
So,
you'll
yeah,
be
it won't
getting
take long.
yours. Yeah, you'll be
Super.
getting yours.
So all of that, and tell people how they can reach your website and find out, how to connect and hear more about your work and more about, obviously the book. You've let them know they can get it, pre-order it on Amazon right now. They will be in the bookstores soon, and
Yeah.
they can reach you how on your website.
So relationshiprx.com is my website that I'm transitioning to, but I realize a lot of people know me by name. So my drldabney.com, so drldabney.com website is now also attached to Relationship RX. So however you find me, it'll head to where I am and where all my resources are for you. And I'm also on Facebook, Instagram, and LinkedIn. And again, either through my name or Relationship RX, it all funnels into one place to me.
Super. Relationship RX. What a great title and a
Thank you.
good thing to know. And I'm really excited to have had this time to talk with you today. I'm sure we'll talk more as the book gets out into the world and how it navigates its way. And hopefully, I know it's going to make a big difference. I know your work, obviously, and I'm excited as you are to be a, a grandparent or godfather or whatever,
Right.
part of that I can share with you. I'm excited for it. So for now, we'll say goodbye, and I will keep in touch with you as we move into the future.
I do think of you as my literary mentor, so I do hope we keep in touch, and I will definitely use your advice as best I can.
Well, good. Well, we'll talk more in the future.
Great.